Part two now of my interview with USC professor Eileen Crimmins about the study on pandemic fatigue. You know, it's interesting, there was and continues to be a push from leaders about using virtual technology to stay in contact with people, things like Zoom, FaceTime, Skype. Do you think most people believe that the virtual experience just isn't the same and would rather go see friends and family in person?
Well, it isn't the same. I know personally I would rather see friends and family in person, but it's much better than the alternative of not seeing friends and family at all. I do think that you can develop virtual conversations and you can stay in touch with people on a regular basis. And it may not be the perfect substitute, but it is a substitute, and it may be what we have now that's really safe.
The study also noted that there was a difference in the pandemic response for minorities and women. What can you tell us about them? Why do you think that is?
Those groups responded better. And we did have controls for going out to work and being essential workers, but which could be part of the reason members of minority groups, which is African Americans and Hispanics, adopted behaviors more than the white non-Hispanic population. But it may also be that those groups have seen that the infection rate in their minority group is much higher than in the white population. And it may be that they see personally their risk of getting infected is higher, so they behave better or with more caution.
So it's clear that pandemic fatigue is real. But
Yes,
what
I
needs
think
to
it
be
is.
done? What needs to happen for people to not get fatigued and for people to reverse this?
Well, I think people have to realize now, with the infection rates so high around us, that now is really the time not to be fatigued. Just hang in there for a few more months, hopefully with some of the things that have been implemented, the stricter lockdowns, not total lockdown, but the stricter closures in the last week or two in California, that may help reduce the cases. If the cases are fewer, there's less likelihood you're going to get infected when you go out and do anything. So people need to really be careful now. They need to be careful over Thanksgiving. So what'll happen is if the cases fall, then things get a little safer and you may be able to see people more. But in the meantime, people really have to think of alternatives. They have to think of outside gatherings. They have to wear masks. They have to not share plates at dinner tables. They need to be careful to not be spreading germs at family dinners. And that's going to be very difficult over Thanksgiving. But if we can make it through this and we get to the point where there actually is the distribution of a vaccine, and hopefully that's within 4 or 5 months, something like that, and older people then get in the line and are first to be vaccinated, they'll be in much better shape.
All right, Professor Crimmins, we appreciate your time. Thanks so much for joining us.
You're welcome. Glad to be here. Bye-bye.